All right, I'm Andrea Morgan. I'm a school counselor at Ravenna Schools at the elementary level. I'm one of two of the elementary counselors. So we implemented red flags this year. One of our biggest things that we did was we decided to roll it out at our district PD day. So all 7 of the counselors, we all got together and we met with our curriculum director to figure out our protocol and what we wanted to do with the program. So we introduced it to staff, like I said, at PD Day. We had a mental health night for our parents at the elementary level where we had community agencies come. So we had Coleman, we had Children's Advantage, Family Community Services, and then we had Town Hall too. We had them all come so that parents could be aware of the program we were implementing and resources in the county. Staff has been very receptive to it. We've been really excited with the reaction. We now have our protocol that all of our staff utilizes is a counseling department. We now all track students the same way, we keep data the same way, we document the same way, so it's really helped to streamline our program and help track them between schools. When they go to the next school, a big concern sometimes is the transition and some of the kids that might slide under the radar, so now we have a better way of tracking that. So in Ravenna, the way that we are doing the program is we're implementing year 1 curriculum in grade 4. Year 2 curriculum is going to be implemented in grade 6, and then year 3 curriculum is going to be implemented in grade 9. So the kids who are not receiving the curriculum that year, for example, if it's taught in grade 4, we're going to target kids based on the year 1 curriculum for small groups in grade 5. So it's going to be something that we talk about each grade level, which will be very helpful for our kids. It's going to be a consistent message that they hear year to year. One of the most exciting things with the program, we've really noticed again the staff, how much they've responded to it, and we've had teachers talk about it, we've had teachers refer kids to counselors, which has been nice, but the biggest one I think that I noticed was when our food service, we have 2 women who work in our lunchroom food service who came in and they had notified me about a student that was coming in every morning very solemn, very sad, not herself. Her whole demeanor had changed and they were concerned for her. And they had they even said to me that they had noticed some red flags. And I thought, wow, this is perfect. This is how I know that when we taught staff that it was very beneficial and that they learned a lot from it. Because I think that was a student that might have kind of flown under the radar, one that I wasn't aware that was having any concerns or any issues. So that was probably the most exciting thing I've noticed is the staff that has really kind of caught on to the program and been really interested in getting these kids help.
My name is Carly Fry. I am a middle school counselor at Stanton Middle School in Kent, Ohio. We service approximately 800 6th, 7th, and 8th grade students here at Stanton. As far as my testimony with the Red Flags protocol and framework, our entire school district has begun to implement the program. Our teachers have begun using the checklist that you'll see in your packet, and they're feeling very comfortable with that because it is very simple to use to identify specific behaviors. Our district has also begun collecting data about the comfort and knowledge base that our teachers already have so that we can drive our services as far as what we're training them in. We will be using the curriculum throughout the 6th, 7th, and 8th grades. That will be progressive over the next 3 years. So that by the time it's in full go, it will just become common language and common understanding that children do feel comfortable and have the opportunity to speak to their school counselors and adults that they trust.
I'm Amy Mohan. I am middle school counselor at Ritztown Local Schools. I have about 300 kids here in my building. Our district has 3 buildings, a high school, a middle school, and an elementary school, and there is 1 counselor per building. So we're a smaller district, and this is our first year for Red Flags. And so far, I think it's an amazing program. Start off the school year with a training, kind of going over the whole Red Flags program with my teachers, and distributing the checklist to all of them so that they can, work with each other and with the students to kind of help diagnose, I shouldn't say diagnose, kind of help follow up on kids who are a little more quiet or a little acting out of the ordinary, to kind of give them some help, and so we can give some guidance to the teachers as well as to the parents. The kids don't really know what mental health is. When you say mental health, they kind of get this, oh, that's for crazy people. And so I want them to understand that it's not crazy people. Everybody has mental health, and it's good or bad. And what can we do to make everyone's mental health better? I also like, there's these really neat appendices with different things that you can do for the kids. And one of them is an attachment that you can send home with report cards each of the 4 grading periods. And I did that after our first grading period, and the response was great from our parents. I had a parent call literally the day after report cards went home just to kind of check in. Hey, my kid's showing some of these signs. Could my child be depressed? And it was just really nice to see the interaction with the community and the parents wanting to learn and being interested in mental health.